This video studies challenges during an IOL implantation and provides us with tips for a smooth and successful implantation. Acrysof Clarion is an extremely popular lens. While inserting it into the cartridge, we have to make sure that both the haptics are well folded over the optic and then pushed to the tip of the cartridge. I prefer to use a screw mechanism of injector since it allows me a very smooth and controlled delivery of the IOL into the anterior chamber. The material of the Clarion lens is soft and elastic. The inner bore of the cartridge is a little wide, so it is imperative that we fold the haptics over the optic. I would suggest that we just inject half the optic first into the cartridge and then fold the haptic over it to avoid the improper placement of haptics over the optic as shown in this video. You can see that the trailing haptic has not really folded well. The plunger has passed below the optic, so when the lens is delivered into the anterior chamber, the optic gets compressed at the mouth of the cartridge and we end up with a crack in the optic of the lens. Another peculiar problem that we see, especially with the hydrophobic lenses, is that the haptics get stuck to the optic. We just have to wait for the haptic to detach, or we can gently agitate it with a dialer. In the Technis series of lenses, we do not fold the haptics over to the optics. The inner bore of the cartridge is a little narrow. Hence, we will require greater pressure to push the lens forward if we fold the haptics over the optic. The advancing haptic should come out in a form of a knuckle. In this case also, I am using a screw mechanism injector. Especially with Technis, that is very important considering the narrow bore. However, in this technique, once in a while, there will be a premature release of the leading haptic. Though it rarely causes any problem, one has to be careful while it turns in the correct orientation in the bag. It can potentially flip the lens over, upside down. A greater problem is if the trailing haptic gets stuck between the plunger and the cartridge. This can happen if we don't engage the haptic properly to the edge of the optic while loading the lens. The simplest solution to this is to keep advancing the plunger till the haptic is free and then implant it into the bag. If the haptic is badly stuck and this doesn't work, in that case what we can do is we can screw the plunger back into the cartridge and this would release the haptic. In no case should we attempt to pull the haptic out using a forceps because this can potentially damage the haptic. You can see that now I am withdrawing the plunger back into the cartridge by unscrewing motion. The haptic is free and we can proceed with the implantation. An uncontrolled entry into the anterior chamber can happen if we are using the shooter variety of the injector. This can cause a hyphema or even a PC break. In case of a hyphema, the primary aim is to first put the lens into the bag, then clear the hyphema and fill the chamber with air and wait till the bleeding stops. The Rayner lenses nowadays come in a preloaded injector. When the leading haptic comes out, the bevel of the injector should be facing to your left. When the optic comes out, it should face down, and when the trailing haptic comes out, it should be facing to the right. The same way that we do with a 3-piece lens. With a preloaded lens, sometimes haphazard lens delivery can happen. The repositor in the left hand can be used to guide the lens in a proper direction and orientation in such cases. A slight disadvantage of the preloaded system. The Hoya 150 is the lower end lens of Hoya. It comes preloaded in an injector. The screwing mechanism is pretty hard and tough. The prongs of the plunger are a little long, so they don't really release the lens fast enough. Usually the repositor in the left hand is used to disengage the lens from these prongs of the plunger. At times it can be pretty challenging, as in this case. The mouth of the cartridge is pretty narrow and hence we can go all the way into the anterior chamber to inject the lens. A wound assisted delivery should not be attempted with a Hoya 150. In this case, the lens could not be implanted since we can't reuse a preloaded lens injector. A different injector had to be used. It is put in a butterfly cartridge and injected using a different injector. Hoya Vivinex and Impress come with a completely different injector which is really very advanced and very smooth. It can be injected with both the motions, either as a shooter or as a screwing motion. The Acryol or Magnificent series of Care Group comes with a butterfly cartridge. Again, the bore of the cartridge is a little narrow, so you do not fold the haptics all the way across the optic but just engage the optics at both the ends. Before we lock the cartridge, we should move the lens forward to check that it is completely free. Through a 2.2mm incision, the lens has to be implanted in the wound-assisted fashion. The trick is to implant in one motion and do not release the counter pressure with your left hand. Infrequently, the haptics can get stuck to each other in a handshake fashion. We just have to wait or gently agitate with a dialer. The IDIF Ultima and UNA series of lenses also come in a Rayner design with a butterfly cartridge. The technique of loading remains the same, with the haptics not being completely moved across the optic. I implant this lens also through a 2.2mm incision with a wound assisted technique. The counter pressure is very important and the lens should be injected in one motion, not stopping at any time. Otherwise, the lens can get stuck into the incision. Since the lens is a little bulky, it takes greater pressure to inject it, and at times the trailing haptic can get stuck into the silicone plunger. The principle remains the same. Come out of the anterior chamber. First, try to push the plunger forward. If that doesn't engage, then pull the plunger back till it frees the haptic. The Zeiss triphobic lens comes as a partially preloaded one. The lens is in a different segment which has to be engaged onto the injector. Then the cover is removed, viscoelastic is put, and the butterfly flaps are closed. It is a plate haptic lens and it can be injected through a 2.2mm incision as a wound assisted technique. Assembling the lens holding segment onto the injector does take a little getting used to. The acryl is a bifocal. Zeiss comes as a non-preloaded lens. It comes with a butterfly cartridge, so we have to ensure the 11 to 5 positions of the holes to get the lens right side up. It is a plate haptic lens and injected through a 2.2mm incision. The Bausch & Lomb Acryos AO lens is a 4 haptic lens. I usually inject it using an Acryol cartridge. The implantation is smooth and hassle-free through a 2.2mm incision.